Greetings from Citizen Health and the Team Academy IAPS and Connect. And today, in the series of People's Health, we have Dr. Susmita Chaudhuri, who is Assistant Professor in Community Medicine, ESIC Medical College, Jhoka, Kolkata. A very warm welcome to you, ma'am, on behalf of our all audience.
Thank you so much, Ritu, and it's a privilege for me to talk on the topic. And thank you, IPSME Connect.
Thank you, ma'am. And I would tell everyone that today we are going to talk about a topic which is very sensitive these days. This is very sensitive topic always. It is a gender. Today's topic is gender. So please tell me, ma'am, that what is gender before we go through the topic. First of all, I would like to know that what is gender.
Aptly said. Gender is a very important terminology for all of us to know first before we move on to the proper topic. Our proper topic is on gender issues in health, specifically to the public health, as I belong to Department of Community Medicine. So when we say the word gender, the first thing that should strike our mind is it is about a socially constructed characteristic. That means it's important to understand gender in terms of sociology. It's basically the roles, the norms, and the relationships between a man and woman. So when we use the term gender, think it's a simple social character or characteristic or construct.
Okay, so what is the basic difference between gender and sex? What does
Right, right.
hmm.
So whenever we, in common day-to-day terminologies or in common day talk, we always, mix this gender and sex, and it's every time used interchangeably. But if we want to see more on the scientific ground and on the sociology ground, then sex it's mostly related to the biological conforms or the biological characteristics, and whereas your gender, as I said, this is mostly for your social construct, the physiological phenomenon, the physical phenomenons, chromosomes, the gene experience, gene expressions, those hormones, these are mostly related to your sex, and gender is mostly a role of how society has given us the norms and roles.
Okay, so how do you think that these gender or sex can influence our health?
Exactly. So whenever we talk about these two issues in health, both has got their a different what to say impact on health. So first, we let's think about the normal biological phenomenon, that is sex. Like our hormones are responsible for certain sort of diseases, our physiological status, our genetic and cellular mechanisms are again they have play some role, they used to play some role in constructing one kind of disease. Say for a simple example which I wanted to share is that uh, recently we have like almost come over from COVID-19 pandemic, and we in certain literature, and it has been scientifically proved later on also, that men, that means those male people, they have got more preponderance of having this COVID-19 infection, and they face severe kind of outcomes compared to females in context with COVID-19. So here I can explain how the gender as well as sex both has played a role. So as I said, sex is actually about your biological phenomenon and hormones. So the scientists have found out that men has got higher amount of a certain enzyme that is known as angiotensin converting enzyme, ACE we call it. So that enzyme is responsible, which has got more like binding capacity with our coronavirus. So that is the reason whenever the impact of outcomes we see, it's affecting more for the meals. This is the role of sex. And now, if we just say in terms of gender, the same example I'm giving in terms of gender. So they say that males has got, less, they are more exposed to outwards activities, and they have got like higher rates of smoking and alcoholism, and in hand washing also lower rates of hand washing has been found among the male people usually. So that can have a role in like having bigger outcomes or worst outcomes in context of COVID-19 infection. So I think this example justifies the difference between age and sex.
Right, ma'am. As we understood that how it influence our health, but I am sure that there is a link between our this gender
Exactly.
and health. So, what is
Exactly.
the link between gender and health?
Gender and health and sex, it's completely interrelated, even if we try to segregate it in this way with definition, but in practical life it is always linked. For example, gender can influence your personal experience of crisis and emergency situations. Like for example, given a situation, the way I will react, the way the some other gender will react or some other person will react, it's a little bit different. And exposure to the disease also, as I said, like exposure to your water hygiene and sanitation also, differences are seen between male and female, as well as access to health services. If we see the statistics, we will be discussing in our in the later part of our talk, where how the females of India has got lesser access towards the healthcare facilities. So these are the domains which actually influence health in terms of your health context. As if again, if you see, females have got lower decision making power, and they are mostly victims of violence, even if it's intimate partner violence. Unintended pregnancy is also very common. And if we see STI, that means sexually transmitted diseases, HIV, AIDS, malnutrition, and depression, starting from physical health to mental health. Everywhere, if you see the statistics which has been given by our WHO as well as Indian Ministry Health Report, reflects that females are in lower position than male in terms of health outcomes.
Okay, so ma'am, there is a term I have heard, intersectionality.
Okay.
Maybe know about this. What is intersectionality?
Intersectionality is a terminology which is again linked to sociology, and it actually talks about your gender power dynamics. And this terminology has been aptly used by World Health Association, and it's an international terminology which has been used. In simple term, if I would like to explain, is that how this gender power dynamic between male and female, or maybe transgender, which has come up, it has got a play in between, and that dynamics is very important for us to know, if it's for the policymakers of health, maybe for the healthcare providers, how it can really improve the health of any female or any those transgenders in health sector. Say for example, a very good example which can be shared here is about our indigenous population, the tribal population. They have got poorer health outcomes in terms of females, in terms of under 5 child, in terms of many adult male also, because the power dynamics which plays between the gender as well as the privileged population and the underprivileged population, that dynamics is only known as your intersectionality.
Okay, so we always talk about gender equality. Do you think that there is a connection between gender equality and men's health?
Absolutely. We always are focused mostly on uh, women's health, mostly on under 5 child, and mostly of indigenous population, tribal health, etc., etc. But we should never forget that gender equality has to have be concerned with men's health also, isn't it? So, if you just see that the power dynamics which they usually males, they usually have to have that from society point of view, they tend to feel the pressure, and it's a documented fact in documents, international documents like WHO and UNICEF also, that this leads to increased intention of taking smoking and increased sexual health behavior, ill behavior, misuse of alcohol, misuse of drugs. So It's always related to men's health, and men's health has got that indirect outcome and relation to the under 5 as well as the female outcome also. If we just see here for Indian context also, the family planning methods, which was traditionally focused mostly on the females. Previously, reproductive health, family planning means ke like only females has to use the methods, but this is not at all true in this context. If we see, many family planning methods have been promoted in males, isn't it? And as well as if you see the WHO theme for breastfeeding, these days they are talking mostly about family support and the partner support. So male has got an important role in health, in framing the health outcomes of females as well as the under 5 kids.
Okay, so what is gender mainstreaming and how it is
Gender,
related to LPG?
okay. Gender mainstreaming is the process of assessing the implications for men, women, and gender diverse people of planned action. That means, in simple term, if we have to understand the mainstreaming of genders whenever we make policies for any health program, we need to include all the diverse population, both male, female, as well as those indigenous people, as well as those transgenders. We have to mainstream all the genders in formulating the policies of any health issues. This is indirectly again promoting the example which I have given for the breastfeeding as well as for the family planning. In fact, for school health, reproductive and child health program, this has come a very important topic, gender mainstreaming, and it has got many roles in your sustainable developmental goals also.
Like for any example, ma'am, for
Any
SDG?
example of I think we almost all are aware of our sustainable developmental goals. So these are the goals which has been framed, and central agenda is by 20 and 2030, almost the targets has to be reached by 2030. So there are around 17 SDG parameters which we know. Here we will talk about only two parameters, that is goal 3 and goal 5, which is actually directly related to health. Other parameters are indirectly related to health. So sustainable developmental goal 5, it talks about your gender equality, and it has got around 45 targets and 54 gender specific indicators. So those indicators will tell us how much improvement we have done in terms of our gender equity or not. And your SDG 3, which talks about universal health coverage. That means, above all, every single person, irrespective of its age, sex, race, status, etc., any other parameter status, should have the coverage of health. That is the agenda of universal health coverage. And for attaining that universal health coverage, we need to have this gender equity, which has been dominated by SDG 5. And this universal health coverage is actually the main agenda or main core of any national health program, especially the national health program which is going on, a national health mission. That is the core idea of almost all the programs running in India in terms of health.
Great. And maybe know about a role of WHO regarding this.
WHO, World Health Organization, has been working on gender issues since long. Here we're not talking specifically about the transgenders because the most important part of this has already been, I think, covered in transgender session. So I will be mostly talking about the female health and the underprivileged female populations. WHO has given us the guidelines. These are for policy making and country level action plans, which has been formulated in India. That has been actually given by the protocol, has been given by the prototype, has been given by WHO. And if we just see and discuss the Indian scenario, we'll get to know how they are being helping in formulating Indian context, as well as those training, the standard guidelines, everything has been already put forward by World Health Organization.
Okay, so as you are the representative of our doctors, I would like to know that what is the India's perspective in related to health and sex and
Exactly.
gender?
So, if we just see traditionally in Indian context, major focus is always have been to the females as an underprivileged population, and we know many reasons of poor health in females. The main first and foremost reason is poor nutrition, as we know that females of India lack in iron, and iron deficiency anemia is much more commoner in Indian context. And as well as this is common for the reproductive age group women, that means who are like going to deliver or having a baby, as well as it's commoner even in the adolescent group also. Adolescent means 10 to 19 years of age group. So as well as in the child under 5 also, if you see throughout the life spectrum, they have got this iron deficiency. And again, this gender discrimination comes into play. Gender discrimination, if you just see the statistics which Southeast Asian context in India they have published by WHO, they say that 6 in 10 women make major decision in household till today, and for every 8 men, only 7 in India have got regular access of mass media. Why they are mostly focusing on mass media is because mass media is one of the way of generating the awareness about health and the power dynamics or the decision making capacity. So this is an indirect indicator which is related to health. If we see the literacy rate again, it's 65% round in the female as compared to 82% in male. Again, if we see women labor force participation, it's almost 3.5 times lower in females. So if you see that even in adolescent girls also, only fewer than every five female adolescent girl even has heard of the term of STI or HIV. So there are many statistics which can tell you the position of Indian females, which shows what is the reason for this poor health outcomes in India in terms of female, as well as low age at marriage. Child marriage is rampant. Low risk factors of different pregnancy outcomes, say for example unplanned pregnancy, then unsafe abortion, limited access to family planning methods. These are all reasons why the females are facing this kind of issues in female. Here I would like to again put some points which have been done in India till today to bring or to shorten the gap of the gender inequality in terms of health. Say for example, there are many schemes which are running in India. JSY, Janani Suraksha Yojana. So this Janani Suraksha Yojana has been known as a conditional benefit scheme to female. So mothers, this is for the for promotion of institutional delivery. In simple terms, we encourage mothers so that they can come to institution and deliver there. So what are the ways of incentives that can be given? Government has given us condition incentive in terms of money. So this has been divided in two groups. Entire country has been divided either in low performing state or in high performing state. Example of low performings are your Bihar, then Uttarakhand. These are the examples. So there they are giving incentive to the females, some around a rural population ke liye 1,400 and for urban population ke liye 1,000. So the females who are delivering in institution hospitals, they will be given this money. And the healthcare worker, that means ASHA, accredited social health activist, they are the persons who are assigned for the duty of taking the mother from home to hospital. And ASHA is also given some sort of incentive, some around 600 rupees in the rural area and some around 400 rupees in the urban area. So that is how they are promoting that females can come to institution, and so pregnancy related complications can go down, and indirectly it can lead us to a equality. There are many other programs which are also running. PCPNDT Act, where if you have heard of this, prenatal diagnostic, preconceptional prenatal diagnostic tests, where the female feticide, or previously knowing whether a girl child is there, and then through USG, and again if you are like committing any sort of criminal abortion and all, for prohibition of that, this act has been running in India for so long, and this is actually a punishable offense, and a certain amount of money and jail, the punishment is also been designed by government of India. Then again, MCTS, mother and child tracking system. So digital era, this MCTS, they are giving a unique identification number to each pregnant lady. And this pregnant lady has been traced from antenatal time, during the pregnancy, then again postnatal time, that means after the delivery, until she has given birth to the child, till 6 months. That unique identity number, that card is maintained, and each and every time all the healthcare follow-ups has been tracked. And through SMSs, there has been a system which has been come up, okay, like through SMSs, there are apps, Kilkari apps and all those things, etc., have been launched, which give you the time when they will give you the SMS. Okay, the next immunization date is this much. Next checkup time is this much, like that. So the tracking system has been aptly built in India. There are much more programs which has gone up for promoting the mother's health also. Lakshya certification, which has been newly again launched. This Lakshya certification actually is to maintain the quality of labor room. Labor room means where the mothers are getting delivered normally. And in OT, cesarean section, they use operation theater, OT. So for maintaining this quality of, they have put some standard guidelines, and the quality of this OT and labor room, if it is maintained, then from government side, this Lakshya certification is given. So this is also one way of promotion. An Anmol Volcaic This is again ANM online, where the online digital platform, each and every mother is tagged with an ANM, and then all the components of health, especially in regard to your mother and delivery time, has been linked up. So in this way, actually, we all are running towards mainstreaming the gender issues. And for today's lecture, I've been mostly focused on the female health and reproductive health only. There are much more bigger issues in gender and public health, which is related to it, and again transgender, which is again related to underprivileged tribal health population, which is again related to male health, specific male health or male issues, and some other lower privileged slum workers or dwellers, etc. This could have been a better discussion that we can again cover up in subsequent sessions, I think.
Definitely, definitely, ma'am. Thank you so much. Thank you so much for this beautiful talk. We come to know about so many programs and applications for women's and child health, and I hope that we will continue with some other program in our this Citizen Health series. Thank you so much, ma'am, for being with us.
Thank you so much.